People who are more likely to get hepatitis B include those who 1. Use injection drugs, or if you share needles or have sex with someone who uses injected drugs. 2. Have had more than one sex partner in the last 6 months or have a history of sexually transmitted infections. 3. Are infected with HIV. 4. If your parents were born in a part of the world where more than 8% of people are infected with HPV and you didn't get a vaccine as an infant. 5. Are born in a part of the world where more than 2% of people are infected with HPV. 6. Live or work in a care facility for people with development disabilities. 7. Have diabetes. 8. Are infected with HCV. 9. Have lived with or had sex with someone who has hepatitis B. 10. Are on kidney dialysis. 11. Have high levels of liver enzymes such as alanine aminotransferase ALT or aspartate aminotransferase AST. 12. Work in healthcare or another profession where you have contact with blood, needles, or body fluids. 13. Have lived in or travel often to parts of the world where hepatitis B is common. On one hand, having a chronic HPV infection can lead to serious complications, such as 1. Scarring of the liver, cirrhosis. The inflammation associated with the hepatitis B infection can lead to extensive liver scarring, which may impair the liver's ability to function. Cirrhosis is a condition in which scar tissue replaces healthy liver tissue and prevents your liver from working normally. Scar tissue also partly blocks the flow of blood through the liver. As cirrhosis gets worse, the liver begins to fail. Number 2. Liver cancer. People with chronic hepatitis B infection have an increased risk of primary liver cancer. In fact, healthcare providers consider chronic hepatitis B to be the leading cause of liver cancer. Liver cancer itself is one of the leading causes of death in people with chronic hepatitis B. 3. Liver failure, in which your liver is badly damaged and stops working. Liver failure is also called end-stage liver disease. People with liver failure may require a liver transplant as it is life-threatening. It usually follows cirrhosis. Number 4. Hepatitis D. Hepatitis D or Delta virus is another viral hepatitis infection that only affects people with hepatitis B. If you have chronic CHB, you can get both viruses. This is called superinfection. It doubles the stress on your liver and can lead to acute liver failure. Number 5. Reactivation of the hepatitis B virus. People with chronic hepatitis B who have suppression of their immune system are prone to reactivation of the hepatitis B virus. This can lead to significant liver damage or even liver failure. This includes people on immunosuppressive medications such as high-dose corticosteroids or chemotherapy. Before taking these medications, you should be tested for hepatitis B. If you test positive, you should be seen by a liver specialist before starting these therapies. 6. Other conditions. People with chronic hepatitis B may develop kidney disease or inflammation of blood vessels. On the other hand, for acute hepatitis B complication, we have liver failure. Acute liver failure is a condition in which the vital functions of the liver shut down. When that occurs, a liver transplant is necessary to stay alive. What are the serological markers? Hepatitis B surface antigen is number 1. It is a protein on the surface of hepatitis B virus that can be detected in high levels in serum during acute or chronic hepatitis B infection. The presence of hepatitis B surface antigen indicates that the person is infectious, except when it might be transiently positive within 30 days after a dose of hepatitis B vaccine. The body normally produces antibodies to hepatitis B surface antigen as part of the normal immune response to infection. Hepatitis B surface antigen is used to make hepatitis B vaccine. Number 2. Hepatitis B surface antibody. The presence of anti-HBs is generally interpreted as indicating recovery and immunity from hepatitis B virus infection. Hepatitis B surface antibodies also develop in a person who has been successfully vaccinated against hepatitis B. Among vaccine responders who completed a vaccine series, anti-HBs levels can decline over time. However, the majority are still immune and will mount a response when exposed to HPV. 3. Hepatitis B core antigen. The nucleocapsid protein core of HPV is called HBC antigen. It is not detectable in serum by conventional techniques, but it can be detected in liver tissue of persons with acute or chronic HPV infection. Number 4. Total antibody to hepatitis B core antigen. It appears at the onset of symptoms in acute hepatitis B. It is a measure of both IgM and IgG and persists for life. The presence of total anti-HBC indicates previous or ongoing infection with hepatitis B virus in an undefined time frame. People who have immunity to hepatitis B from a vaccine do not develop anti-HBC. Number 5. IgM antibody to hepatitis B core antigen. Positivity indicates recent infection with HPV less than 6 months. Its presence indicates acute infection. IgM anti-HBC should be ordered only when acute HPV infection is a concern. Number 6. Hepatitis B E antigen. This is a protein from HPV found in some patients who are positive for hepatitis B surface antigen. Measuring this antigen can help doctors understand infectivity, your ability to spread HPV to others. 7. Hepatitis B E antibody. This is produced in response to hepatitis B E antigen. The disappearance of hepatitis B E antigen and detection of anti-HBe in the blood, called seroconversion, suggests improvement of the condition and predicts long-term clearance of the virus. Chronic liver disease is more common in those with hepatitis B E antigen and is less common with hepatitis B E antibody. So this test may monitor acute HPV infections. 8. Hepatitis B viral DNA. A hepatitis B viral DNA test detects the virus's genetic material and determines the viral load in the blood. A positive test indicates that the virus is multiplying in a person's body, making that person contagious. The test is often used to monitor the effectiveness of antiviral therapy in people with chronic HPV infections. So let's summarize. Hepatitis B surface antigen is the hallmark of HPV infection. Hepatitis B core antibody is observed during acute infection. Total antibody against HPV core antigen indicates the presence of IgM and or IgG against the core antigen. A positive total anti-HBC with negative anti-HBC IgM antibodies indicates resolved infection. Hepatitis B envelope antigen is viral protein associated usually with a high viral load and high infectivity. Antibody to hepatitis B E antigen usually indicates decreasing HBV DNA. And finally, hepatitis B surface antibodies are a neutralizing antibodies.